Okay, Stephanie,
Yes.
tell me what's going on with you, what you'd like me to help you with.
Yeah. Well, mostly where I have tightness and pain, it's my neck and
Okay.
shoulders and the back, the entire
When
back.
you say shoulders, which area are you talking about?
Well, this area, and
Okay.
recently I've been having pains here whenever, well, I can be just sitting down and I feel like a sharp pain in my
Right in
shoulder
there.
here on
Okay.
both shoulders.
Okay. Is it worse like when you sleep, laying on it, or just?
Yes. Well,
Okay.
it's like any time, but whenever I, sleep on any of those sides, it just hurts.
Okay.
Mhm.
You ever had any serious injuries, accidents?
No, not injuries, but a few years ago, I was very sick and I had like a cold or something like that, and I was just not getting better.
Okay.
And I was taking medication, which I can't remember what it was, but one night I remember that I woke up and I felt like a burn sensation throughout my neck, and right there and there I felt like lightheaded. So
Okay.
I thought it was something with the brain. So I went to all different specialists to see,
Mhm.
and it ended up being just my neck from the stress. My neck, all the muscles were just
Did they do a
tight, and
CT scan on you
they
then?
did everything. I
Okay.
mean, I went to the neurologist, and I mean, they did everything. And it ended up being, one of the doctors just touched me, and he said, the shoulder area, and he felt it very tight, so he sent me to therapy.
Physical therapy.
And
Mm-hmm.
it I mean, it helped
You did.
a lot.
Okay. Have you been to a chiropractor?
Yes,
Okay.
but never touched the neck
The
area
neck.
because I'm
Okay.
just scared. But I right now I've been having this weird episodes where I just wake up gasping for air. So, and palpitations, and it's, I mean, very scary. So I went to the cardiologist, and
Mm-hmm.
I have a Holter monitor right now for a month.
Okay.
So I had two episodes last night, or it was midnight, and I called the cardiologist and I said, can you monitor to see what happened with my heart during that time? And she said everything was normal. So they also sent me
Everything
to
was normal as far as
the
a
heart
physical
goes.
exam. Okay, but
The,
the whole, did they get that information off the monitor?
yes.
Okay, so it
So it's
said the
like a
monitor.
live
Right, right.
monitor.
So that
Yeah.
was okay. It was
Yes.
at the moment. Now they're doing it over a period. How long are they doing it for?
It's for a month.
For a
30
month.
days.
Okay. Okay.
They're ruling that out, and then they also sent me um, to check my thyroid, and
Mm-hmm.
to check for sleep apnea.
Yeah, they got that panel back or the tests back.
Well, I did get blood work, and it showed that it was hyper. My thyroid was hyper,
Oh,
so now
hyperthyroid. Okay.
so now I'm going to.
That could cause a little dizziness.
Yes.
Yeah.
And I mean, I'm anxious all the time. Like it's bad. I think I also had a panic attack on Tuesday, I think it was, and I had to go to the ER because I mean, I was dizzy. I thought I was going to pass out, and my neck felt so tight, where I was lightheaded. It was really bad.
What did
So,
they tell you, or what did they do?
what at the ER they did an EKG. Everything came back normal. A chest X-ray. Everything came back normal. So they figured it was just like a anxiety or a panic attack because blood work and everything came back normal, except I was low on potassium and magnesium. And I really think everything is just stress. Everything builds up around here,
Mm-hmm.
and all of a sudden I feel just dizzy again and lightheaded.
Did it come on when school started again, or?
Well, it usually,
I mean, that could be stressful.
yeah, I mean, yes, it
Yeah.
is. But I did start having those episodes where I felt like my heart just stopped beating, and then I woke up gasping for air, like in July or so. And then it continued happening. So
Okay. I'm gonna
okay.
have you do me a favor and stand. We'll just look at you like I did your husband. Okay, I'll have you take your shoes off, if that's all right. Okay. Yeah, that one shoulder is just a little bit high on you. Have you turn and face this way. Okay, good. All right, then turn and face away from me.
Oh,
Yep, that way.
Okay.
Yep, I'm just going to check your Achilles tendons and see how they're doing. Check hey, you have good arches. Okay. Okay, turn and face me.
Okay.
Put your hands out there. Just resist as I push down. Okay.
My shoulders hurt there.
Yeah, you know what? Yeah. Let's now what I want on turn and face me this way. What I want you to do is bring that arm up over your head. Okay, is that painful to bring it up?
It's like tight.
Right in
over
there.
here.
Okay, down. And then this one. Okay, that one especially. Okay, now go ahead and bring it down. And I want you to take your thumb and bring it up your back as far as you can.
Like both or?
No, one at a time.
Okay.
That one. Okay, and down. And then this one up. Bring it up. Okay. Now we go ahead and bring it down. I'm going to poke around. Is that tender in there? Not too bad as far as the pressure. How about that one?
A little bit, but not. Ooh, there.
Right in there. Okay. Anything on the back here?
No.
Okay. Now let's lift your arm up. Okay, I just want to feel how that scapula slides on your back there. Okay. This one is not sliding as easy as it should. Okay. I'm going to pull that out a little bit, okay? You all right?
Yes.
Okay, good. Okay, good. Okay, just now I'm going to push down. Go ahead and resist against me. Okay, good. And this one too. Push up and in. Okay, that's a little better. Push this one sideways against my hand. Now, if that's hurting anywhere else, let me know. Okay, we don't have to have you push real hard if it's biting.
Okay.
Okay, push sideways. Now lift this leg up about 6 inches. I'm going to push down just like I did your husband. Now, okay. This one. Okay. Let me adjust your feet first, okay? You all right with that?
Yes.
Good. All right. Good. Lift her about 6 inches. Resist. Okay, I'm going to do it one more time here. Now lift her again. Resist. That's a lot better. Okay. Lift that up. Resist. Now lift her. That's a lot better too. Okay, now. All right. I felt her move in,
Yes.
so I think, okay, go ahead and just relax that. And this one too. How you doing? Okay. Good. All right. Let me check your neck while I've got you down. That's sore? Yeah, that's your atlas. That's the very top vertebrae, and it's out. Okay. Any tenderness along this side too?
Yes.
That's your occiput, so they're both out, both sides, okay?
Oh.
Okay. What I'm going to do is a little bit of loosening. We just turn it, okay? Those I'm pushing on some reflex points like that ear and the muscle. Okay, good. Okay, good. Let's go this way. Okay. Now we're going to give her a little push, all right?
Oh, wait. Oh, yeah.
Okay, just push over. Yeah, I don't push real hard. I can, yeah, see it moved. This one we're going to push your skull down, okay? All right. That wasn't so bad, was it? Okay, now I'm going to hold you right. Okay, good. What I'm going to have you do is grab onto my arm with both of yours, and I'm going to lift you up. Okay, good. How you doing as you're standing there?
Oh, good. That pushing there was relieving.
Good.
Yes.
Good. So if you lay face down.
Okay.
Okay, good. Knees straight. Lift the leg as high as you can. Good. Then the other one. Okay, well, that's not too bad. Any tenderness as I push both sides?
A little bit.
Okay.
Oh, there.
Right up here?
Mm-hmm.
Okay, yeah, that's twisted. Over the top of that one, okay?
That one?
Yep, just like that. Loosen that up a little bit. Now the other way. Good. Right over left. The other way. Good. Uncross. Okay, knees straight. Lift that leg as high as you can. Good. Other one. That's better. Yeah, that's out a bit there, you know. Why don't I work on this up here, and then I'm going to lay on your side. I've got this little thing here. I'm going to adjust your upper back.
Okay.
Yeah, what it does, I just push down. I call it the Woody Woodpecker adjustment.
Okay.
You've okay. This area here is pretty important too, as far as what's going on.
Okay.
This is a heart area. Actually, that's more the heart. This also contributes some. You doing all right?
Yes.
I think that's probably about what we're going to do. Why don't you come on up and why don't you just sort of check yourself out? All right, how you feeling?
Good.
Okay.
Yeah.
You're not feeling too worked over then?
No.
Okay.
Yeah.
Good. We'll see what happens with that. I got that upper neck to move really nice.
Oh yeah.
We did is we pushed it back into place, the skull,
Okay.
and then that first vertebrae, and that's where 50% of your rotation happens when you turn your head both ways.
Okay.
And so we slid those together. And also, that's the foramen magnum where the spinal cord comes through.
Okay.
Well, it's like that, and then we slid them together so that way it's well, you can see you've got more room there, so it's not putting pressure on the spinal cord.
Okay.
And
so you think that will help with the
I think it should.
dizziness?
Yeah, well,
Okay.
I hope so.
Oh yeah, me too.
And that should help with that vagus nerve.
Yeah. Okay.
And then this up here, I worked on you there. That well, that picture doesn't quite show it, but that there is heart. I've seen a lot of heart problems go away. No, somebody comes in having a heart problem, I send them to the ER first.
Yeah, right.
But then, but where you've been through all that,
yes.
Pretty confident that possibly we can help that,
Okay.
or
Thank
quite
you.
possibly.
Yes. Thank you so much.